Mark Spinner.
Brian.
Somebody that I just met. Thanks for doing this.
Absolutely.
It's good to be at HFMA again, where like human beings all over the place. We're connected because I ran into a friend of a friend and we have a mutual colleague that used to work for you and now works.
That's right.
That's how it works in this business.
I've heard your name before, so it's good to make the connection.
Some of it's true. No, thank you for doing this last minute. It was suggested that you'd have something to contribute to the dialogue around RCM.
That's good.
So as I'm getting to know your company, I'm excited that we're going to hang out later and talk about ways to work together. You're tackling FinTech in RCM, focused mainly on providers, hospital providers?
We are, yes, B2B2C. So we are engaging mostly in the enterprise healthcare space, and we just think of it as we're building FinTech products for the patient consumer. That is the true north for us, is putting that consumer in the center of this sort of tri-party relationship and finding the wins for all three parties, but holding true to that North Star of consumer in the middle.
So let me ask you this, because I had the opportunity to see your demo, and I was like, boom. What I think that you've nailed and it's great because you can make that connection very quick.
Yeah.
What strikes me that you've nailed is that elegant experience. We talked about it with Mike Sims earlier, a mutual friend. But I want to be a little bit controversial. So how do you, I looked at that and said, I was sharing with you a story. I had a daughter that broke her wrist. We turned into healthcare consumers instead of running healthcare companies, and we get 5 bills. Radiologist, ER doc, regular physician, hospital, 4 bills. So how am I going to get your kick-ass, seamless mobile experience? Now, I know that you're focused on the provider, and let's start with a hospital. What do you have to do to go live? You're connected with the EMR.
It's very simple. That's one thing that helps us in that sales cycle that can be pretty tough on the revenue cycle side is it's a very light implementation for direct mobile pay, the demo that you saw. So it's really just either an API connection or just a couple of files if the provider is more on the EDI side of the world.
So you interface with something like Epic MyChart?
Sure. We're interfacing with Epic in those scenarios, and we're just...
Or Cerner or whatever,
That's right. And we're just... It's really not a lot different than what the provider needs to do to generate a paper statement. This is just what you would do today if you reimagined how should I communicate and try to capture a payment from someone who constantly has a supercomputer in the palm of their hand.
Absolutely.
That's where we started with this product and the consumer's journey. So we have to sell that consumer vision to the provider, to the RCM leader, and we deal with some tough hombres like Mike Sims, who was sitting in this chair a few minutes ago. And I think it's on us to help them just sort of immerse themselves in the consumer experience. And the president of HFMA in his talk this morning said, how many of you have been a secret shopper in your revenue cycle process and yourself gone from the beginning to the end and experienced it as a consumer? So a lot of times when we do these demos with providers,
it's a good idea, by the way.
Say, close your eyes. You're a single mother, or you're a mother of 3. You're working from home. You're trying to figure out how to find the time to understand this bill you just were not expecting and that you got. It's bill number 2 or bill number 3 in your experience. So we have to get these providers to really step into that consumer experience with us. And when they do, it's pretty quick. As you experienced, we are just burning a lot of energy and time and a lot of smart people and a lot of voice of customer sessions with providers and with consumers to get to simple, seamless, elegant. It looks very easy when you look at it, but it's very hard to get there. So that's been a kind of a journey we've been on from a product organization perspective for a few years.
So, tell me about I'm always pushing for leapfrog moments on a topic like innovation, right? Because the consensus is a decade. Who knows what the right year is? But like, folks like us are trying our hardest to have our clients have those leapfrog moments. So, does this provide a leapfrog moment for your clients?
I think we're at a critical point, and the reason is partly macro with respect to what the consumer is facing today.
Yep.
This inflation is so much bigger and different than most of us consumers have seen. And when you layer that on top of what's been going on in healthcare
since the 70s.
Since the 70s. Yeah. University of Michigan just published their consumer sentiment survey last week, lowest level ever on record. So this consumer is in a storm of pretty epic proportions right now.
Right.
They're getting hit.
It was already bad.
And they were already afraid of healthcare costs to begin with. So I think that gravity should wake up a lot of revenue cycle leaders and say, wow, I really need to take a fresh look at where I'm innovating, how I'm dealing with this consumer. And that to me is the big opportunity here.
Yeah.
It is a crisis, but that pressure, that's our positive pressure. We want to be in that moment with these revenue cycle leaders, and we're sitting down with our largest customers and saying we need to have a strategy session now, because with interest rates moving, with inflation moving, with consumers trying to figure out how to come out of the back end of this pandemic, everything's changing. We need to talk about every key component of this program and make sure we're out in front of this so that your community can take fear out of the equation when they need help from you as a healthcare provider.
What's a happy path use case in your mind? Because these are constraints, they're realities. We got to deal with them head on.
Yeah.
So what's a happy path for that single mom of 3? One of her kids hurt themselves on the playground. Yeah. And now she's got 3 bills. Yeah. That are confusing. Like, how do you make that seamless and clear? But then, what are her options?
Yeah. I think for us, the happy path is if it's a non-emergency situation, she's had a communication up front that created some transparency. Yep. And she had a chance to see at least order of magnitude what this event is going to drive to her in terms of cost. She understands her benefits. So if she knows there's a $2,000 or a $3,000 bill coming out of the back end of this thing, that's in the way of her and getting the care she needs. Yeah. So the provider needs to be able to communicate with her in that moment in a way that she wants to communicate, which is mostly on your cell phone these days. Yep. And show her we have help for you. Yep. Whether it's payment in full, payment, kind of a care now, pay later situation on a short term, or a long term arrangement with a partner. Financing. Be very transparent and proactive with that in this environment. That's kind of what we are preaching in terms of how do you do that. Now, how do you do that? What environment are they in? What other tools are they using? There's a need for collaboration and coexistence because there are so many other technologies at play for the providers. But I will tell you that some of our leadership teams at Enterprise Health Systems do have enough influence and gravity with their other hospital-based providers that are sending that second and third bill from a ER doctor or a radiology or a lab department or anesthesia, and they will bring those players into our ecosystem so that the consumer can deal with all of them through one interface. Yeah. That really works well. Yeah. And we see a lot of consumer satisfaction, a lot of high net promoter scores out of those types of situations, more so than when it's a one-off situation. That's a good point. Are you able to use, whether it's HCAHPS or patient satisfaction surveys, sometimes there's discrete billing patient satisfaction. Yeah. Can you kind of look at historical data and say, I can move the needle in these areas? Yes. Yeah. I think that's another, kind of big opportunity. You see the leap forward. We have done a much better job over the last couple of years of harnessing our data and showing, hey, look at this consumer behavior. Yep. We've refactored this piece to be totally mobile native, and look at the automation that we drove. We've measured Net Promoter Score every quarter with these consumers and look at the trends after we delivered this tool. So getting to the data, asking the right questions, measuring and proving out the automation that it drives, the staff, the phone calls that it eliminates, those types of things in this environment, bringing that data to the table is really important.
Now, how are you addressing financing, right? Are you also interfacing with folks like Care Credit, Care Payment, like?
So we compete in that space.
So so you have a financing
yes.
solution.
We have not only the software tools that you see, but then we'll also deliver as a managed service the whole patient financing continuum. So it can be pay in full, it can be prepay, pay in full, pay over a short period of time, or long-term financing.
Recourse, non-recourse type models?
So our provider, we do have non-recourse and recourse models. But we really stick to our knitting in terms of that consumer being not harmed. So we have a do no harm culture. We will not credit report any patient. We will not hit their credit score.
No soft
We will not deny them access to the program. We will not approve them for $500 when they applied for $5,000. None of those gaps exist. And for us, especially with what's going on in Washington right now and their focus on medical debt, our counsel to health systems is, hey, we think this is the right thing to do. We've created tools, features, options for you to eliminate some of the friction that historically has been associated with some of those programs. So we tend to get in there and there's just a different approach that we're taking that doesn't look like any of those other competitors. So that's important for us to get to that conversation and say, hey, look, there's other ways to do this. And that's about the innovation that we've driven in the program.
What about health savings accounts? I think that's such an untapped, I mean, we use it in our company.
Okay, good.
It works great. It's plug and play friendly with so many things. Are you interfaced with health savings accounts at all?
As a form of payment, they're absolutely part of our program. Now, we don't integrate deeper than that with them. We've had some of those conversations. I do still think that's an opportunity.
There's just not enough employers, frankly, that are leveraging health savings in a way that could be beneficial for their employees, right?
It's you know.
I mean, there's been progress, but there could be so much more.
The deductible seems to take all the attention. And it does seem like there's more to do there. I don't have anything great for the tape on that one, but
you know, I saw a talk.
We've kind of gotten shut out on that quite a bit. We're not interested. So.
Fair enough. I just had this thought. I saw a talk years ago by a health economist, like a forward-thinking futurist, and a legit health economist. And he was talking about using your mortgage, and there have been some models talked about where, so imagine like a HELOC concept, but for medical care. So, because you do have, you know, and not everybody's a homeowner, but you got to offer 1,000 things, right? I love the idea of like, and the government could offer some tax benefits. So you use your home, and there's a specific HELOC where if you have a catastrophic event, catastrophic coverage, you're able to tap that, but with some government-based incentives. I think that, you know, if we're going to talk about innovation, and you and I were talking earlier, I think the government has a big role, and they got to bring more than bureaucrats to the table and, you know, policy writers, because so much of what gets written in the policy, you know, is not, you can't operationalize it. I mean, I could go on and on, but even if you take something like, you know, the latest legislation on hospital pricing transparency, you know, try to read that. You can't operationalize half of what they're saying. So they need to come to the table, you know, on things like that, but be a part of the innovation discussion in my mind. I think you agree.
I do agree. I think there's a leadership opportunity that is there. And the government does have a different amount of leverage in this whole conversation. And it just feels like if we could have some leadership from that sector, that included the employers' health plans and the providers in solutioning, we could make some progress.
Real roundtables
actual experienced people who have a core DNA that want to solve this problem for the benefit of the American healthcare consumer.
Yeah.
And we just hadn't had that yet.
Yeah.
So I think until that happens, the president of HFMA this morning was making that call. He's like, here's the hard truth. Value-based care is where we need to go, and it's going to be really hard to get there. That is true.
It's like it's the old saying about don't let a crisis, however that saying goes, go to waste. Yeah, good crisis go to waste. I think your point about inflation is legit too. I think it's starting to sink in. We see it in the data. We're doing modeling. I mean, we get all the receivables, all the claim data, all the ANC files. You see it, it's happening really fast on patient pay and high deductible health plans.
I think it's going to accelerate. I mean, it's almost like there was a self-pay holiday during the pandemic.
Yeah.
Because people were bracing for the worst, and we all thought, oh, this is going to be really bad. And between the stimulus funds and the lack of spending on discretionary travel, vacations, out to eat, the consumer's wallet expanded.
Yeah.
And we saw it too. We got stimulus-sized payments after those payment dates went out.
That's right.
And so a healthcare leader who sits back and says, well, my self-pay's been pretty good these last 2 years, even during the pandemic.
Right.
The things that I'm reading from the banking industry and the consumer credit industry are like, that artificial stimulus is burning off so much faster than anyone realizes.
Yep.
That storm is coming fast.
Well, that's where we'll have to end it, right? But since that's a big, chewy topic, we need to have you back.
That sounds great.
Because some of these things.
It sounds like you've got some good ideas too. So I want to talk about more of them.
Yeah. Well, come to our party. We'll do a cocktail.
I heard that's a
discussion and see if we can't shake the tree in Washington a little bit.
Sounds awesome.
Hey, thanks a lot. I really
appreciate
it.
Yeah.
Great to always meet new people last minute. So
for sure.
Really appreciate it and look forward to.
Love to have you out to South Carolina, North Carolina too.
Okay. I travel with the team all the time, so
that's great.
We have some trips to the South coming up.
Sounds great.
Later this summer.
Awesome.
So thanks a lot, Mark.
All right,
really
man.
appreciate
Thank
it.
you.
Yeah. Cheers.